Hello, my name is Roderick Bollinger. I'm a nurse practitioner student. I'm going to be doing a physical assessment on my volunteer, Stephanie. Prior to the assessment, Stephanie donned a gown. She emptied her bladder. We obtained a full set of vital signs, including height and weight. Stephanie, so first I'm going to start off this physical assessment just by starting on the top, working my way down. So first I'm going to assess your face and your scalp, your skull. I'm just going to first visualize your face. I see that your face is normal cephalic. I don't see any visible nodules, lesions, no redness, no swelling. I'm going to go and palpate your scalp. I don't feel any lumps or lesions. I'm looking at your hair. I see that it's well distributed. It's very full and very shiny, so you must be taking good care of your hair. Next, I'm just going to go move to your face. I'm going to be just kind of feeling your facial bones. Are you having any pain or discomfort? No? No pain or discomfort. That's great. I'm going to feel your frontal sinuses here. Any pressure?
No.
I'm going to be feeling your maxillary sinuses there. Any pressure, pain, or discomfort? No. I'm going to assess your TMJ. I just want you to open your mouth. I'm looking for any crepitus or creaking. That sounds great. Next, what I'm going to do is I'm going to be testing some cranial nerves here. We're going to first test cranial nerves 5 and 7. Those are your facial nerves. So what I'm going to do is I'm going to have you do a couple things for me, okay? I want you to raise your eyebrows. All right. I want you to close your eyes real tight, and I'm going to try to just resist me. All right. Good job. Puff out your cheeks. Wonderful. Give me a big smile. Show me the teeth. Wonderful. Stick your tongue out. All right, move from side to side. Awesome, great job. So now we're going to be testing some sensation on your face, okay? So what I'm going to do is I'm going to take a light piece of cloth, and I'm just going to be testing your forehead. You let me know if you feel it. We're going to do your forehead, then your cheeks, and your chin, okay? You feel that?
Yeah.
Feel that?
Yeah.
Feel that?
Yeah.
Feel that? All right, wonderful. Now I just want you to grit your teeth together, and I'm going to feel your muscles here, your masseter muscle and your temporalis muscle. Squeeze yep, very well, great job. Alrighty, next we're just going to do some other facial assessments here. I just see that your face is round, no redness or swelling. We're going to be moving into your mouth now. We're going to be assessing cranial nerves 9, 10, and 12. So what we're going to be doing is I'm just going to be taking a look in your mouth. I'm going to have you open your mouth and say, ah, stick out, ah, all right. I will assess the gag reflex while I do that. And for the comfort of Stephanie, I'm not going to do that for this exam. Next, I'm going to be looking inside your mouth. I'm going to be looking at your tongue, noting any swelling or edema. I'm going to look at your uvula. I see that your uvula is midline. I'm looking at the anterior and posterior pillars of the oropharynx. No redness, swelling. The buccal mucosa is pink and moist. No lesions. I'm going to be looking at your tonsils. Let me take a look at your tonsils. Say ah. All right. I see that they are 2+, so that's great. No exudate, no redness, no swelling, no inflammation. I'm going to see your hard and your soft palate. And I'm just going to visualize the back of your pharynx, no redness, swelling. Are you having any difficulty swallowing?
No.
No? Any impairments in taste at all? No? Okay. Alrighty. Well, that is great. Then we're going to be moving up to your nose. So any issues with smell?
No.
No problems with smell. So what we'll do is we'll test your olfactory nerve, which is your first cranial nerve. I just want you to tell me what you smell.
Coffee.
Coffee. All right, great job there. Next, I'm going to be just taking a look in your nose here. Just going to take a look in the turbinates, look at the mucosa of the nose. I'm assessing your septum. I don't see any septal defects and no perforations. Your mucosa is moist and pink, and no difficulty with swelling. Your nose is symmetric. No difficulty with smell. I'm just gonna palpate the nose. No pain? No? Alrighty. Next, as far as the nose goes, I think we got everything covered there. So I am going to move on to the ears. What I'm going to do, I forgot, I'm going to assess the patency of your ear. I just want to make sure you're breathing okay through your nose. Alright, good job. Good job. Any difficulties there? No. Alrighty, now we're going to assess your ears. We're going to first visualize the outer ear, the auricle, looking for any lumps, nodules, lesions. I'm going to be feeling them, any pain or discomfort. Going to be palpating your tragus, your antitragus, any pain or discomfort. No? Alright, wonderful. So next we're going to be looking inside of your ear canal. We're going to be visualizing your tympanic membrane. Alright, so I'm just going to have you just relax. I'm going to take a peek in there. I'm visualizing the inner ear canal. I'm not seeing any inflammation, redness, no otitis externa. The tympanic membrane is clear. It's pearly gray. The cone of light on the left side is at 7 o'clock, and that's right where it needs to be, so that's great. We're going to just take a peek over here at the right and do the same assessment, just looking in the inner ear canal. Alright, a little wax in there, but otherwise I see your tympanic membrane. It's pearly gray. The cone of light on the right is at 5 o'clock. So that is just superb. Then we're going to be moving up to your eyes, okay? So any issues as far as vision goes?
No. Well, I have contacts.
You have contacts, okay. Alrighty, so what we'll do as far as your eyes go is we're just going to do some vision tests here, okay? So what I want you to do is I have my little eye chart here. I'm just going to assess your vision here. Just tell me, can you read the lowest line there?
LTFPH.
LTFPH, great. All right, now I'm going to have you cover your right eye. Can you read your lowest line?
LTFPH.
Perfect. Now do the same with your left.
LTFPH.
Awesome, great job with that. Next I'm going to be assessing your pupils. So what I'm going to do is I just want you to look straight at me, okay? I'm going to shine a light in your eyes, and I'm just assessing for pupillary constriction here. So I'm just going to shine my light, all right. Your pupils are equal, round, and reactive, 3+. I'm going to do some direct here. I'm just shining my light on your left eye and looking for a consensual response there to see if your right eye is moving. I'm going to do the same on that side. Awesome, great, everything is equal and reactive. I'm just going to inspect the outer area of your eyes, your eyelashes, your eyelids are all uniform. I'm going to be palpating the lacrimal duct here. Any pain or swelling? No, it doesn't. I don't feel anything, which is good. Normally we don't like to feel that. I visualized your sclera here and your conjunctiva. They're pink and moist. Your sclera is not red or inflamed. Your inner canthus, your outer canthus look great. No swelling or discharge. I could take my ophthalmoscope here, and what I'm going to do here is you just look straight ahead, all right? And I'm just going to get right in close to you. So and I'm going to look at your optic nerve here and visualize the red reflex. And all right, everything looks good there. I'm going to do that the same side over here. I see the red reflex, optic nerve looks great. All right, now we're going to do a little test we call, it's going to be assessing cranial nerves 2, 3, 4, and 6 here. So we're going to first test confrontation here. So what we're going to do is I'm going to have you close your right eye, and I'm going to close my left eye. I'm going to have my finger up. You tell me when you can see my finger move.
No.
Okay.
No. No.
Okay. Now I'm going to have you cover your other eye. All right, tell me when you can see my finger move.
No. No. No.
All right, great. We're just going to do some eye movements here. So what I want you to do is I want you to just follow my finger. We're going to go down and up, side to side, over here, up there, over here, up here. All right, I'm not seeing any nystagmus. You're tracking well. So that's great. Now we're going to be doing the cover and uncover test. And what I'm going to be assessing here if there's any deviations from your eyes. So what I'm gonna do is I'm gonna cover this eye. I want you to look at my finger here. All right, I'm gonna take this off, and I want you to just keep looking at it. Okay. All right. Wonderful. All right. Perfect. No pupil deviations there, so your eyes aren't moving. I'm not seeing any strabismus. Your pupils aren't droopy, so that's good. No ptosis there. And one other thing, I just want you to, we're going to assess your distant vision and your near vision. What I want you to do is I want you to focus up on that fire hydrant, all right? And then I want you to look at my finger. All right, your pupils are constricting from near to far, so that is great. So your eyes looks like they're in good shape. Sounds like you're doing regular eye exams, so that is wonderful. Now, regards to hearing, we're going to do a test we call the Weber and the Rhine test. And the Weber test, what I'm going to do is I'm going to hit this, put it on the top of my head, and you tell me if you're having any hearing difficulties here on either ear, okay? Can you hear in both ears?
Yep.
Perfect. All right. So no unilateral hearing loss. Now that we're in any test, what I'm going to do is I'm going to hit this. We're going to palpate. We're going to put this on your mastoid bone, and you let me know when you can't hear it. Okay?
Okay.
Can you hear that?
Yep.
Alrighty, and that's assessing that air conduction is greater than bone conduction. We can do that on the other side.
Okay.
Hear that okay?
Yep.
All right, perfect. Now I'm just going to do a whisper test. I'm going to get behind you, and you tell me what I'm saying, okay?
99.
All right, perfect. Perfect. Good deal, good deal. Alrighty, so we've covered the face. I'm going to be assessing your neck now, okay? So some things I'm going to look for in your neck is I'm going to look at your trachea. I'm going to look to see if there's any tracheal deviation. I'm going to inspect your neck for any visual lumps, nodules, any visible pulsations. What I'm going to do is I'm just going to first palpate your lymph nodes. So I'm going to start at your preauricular, your postauricular, your occipital, your tonsillar, your submandibular, your submental, your superficial cervical, your deep cervical, your posterior cervical, your supraclavicular, your lymph nodes, your infraclavicular, and your axillary nodes here. I'm not noting any lumps, hardness, and you're not having any pain or discomfort. Any pain when you swallow?
No.
No. Okay. So next, what I'm going to do is I'm going to palpate your carotid pulses. Okay. And I'm just assessing for any irregularities, thrills, or bruits. All right. Now I'm going to be assessing your thyroid here. So what I want you to do is I just want you to swallow. All right. Great movement. There's no swelling. Next, I'm going to auscultate with the bruit of my stethoscope. I'm going to auscultate your carotids. All right, the bell of my stethoscope. Good. And now I'm going to auscultate your thyroid here. I know, I said bruit instead of bell. I didn't mean to. So next, we're going to be assessing cranial nerve 11 by doing just some spinal accessories here. So I want you to shrug your shoulders. All right. Just try to resist me. All right. Great. And now we're just going to be assessing your neck. So I want you to laterally bend your neck this way. Let's laterally bend here. All right. Let's hyperextend our neck. All right. Let's go back to extension and then flexion. All right. And just let me do some passive range of motions. You just stay nice and relaxed. All right, no creaking, no crepitus, so that's great. So what I'm going to go to next is I'm just going to be inspecting the posterior chest and your back. All right, so what I'm going to be doing is just assessing your back here. I'm going to do assess for any tenderness here. This is just assessing see if your kidneys are having any pain. So I'm just going to give you a little pop. no CVA tenderness. All right, now we're gonna do a tactile fremitus. So what I want you to do is I'm just gonna put my hands here and you say 99.
99, 99, 99, 99, 99.
All right, that sounds good. So what I'm doing is I'm wanting to hear the vibrations. If there's any areas of consolidation, they may be decreased, or if there's excessive areas, it may be a little altered. Okay, so now I'm going to be assessing your diaphragmatic excursion. So what I'm going to do there is I'm just going to be palpating, and I don't see any areas of your ratio here. I'm just going to check your thoracic excursion here by having you take a deep breath in. All right, everything is moving symmetrically, so that's great. I'm going to assess your diaphragmatic excursion here by doing some percussion here. So what I want you to do is I want you to take a deep breath in and exhale. And I'm just going to percuss, exhale all the way, great. Alrighty, now I want you to just take a couple deep breaths, get back to normal. Alright, I'm going to mark this area, and then when you're ready, I want you to take a deep breath in and hold it. Alright, now I'm going to hold. Alright, and I'm going to mark that, and we like to see that about anywhere from 3 to 6 centimeters. And I would do the same on the other side. So I'm just going to take a listen to your lungs while I'm back here, okay? Take a deep breath in and out. All right, great. I'm going to assess your lateral chest here. Are you having any pain or discomfort in your chest when I'm touching? No. All right. Just have you take a deep breath. Great, everything looks good. Your lung sounds clear. Obviously, while I'm doing this assessment, I'm noting any areas of, or any times of excessive breathing or tachypnea, low breathing, any retractions. And I'm going to be doing the same thing on the front side. So you're not short of breath. What I'm going to do is I'm going to be visualizing your lungs here. Noting any visible pulsations. I'm going to feel your precordial area here. Noting any palpations, heaves, thrills, visible pulsations. So that's great. And I'm going to assess for tactile fremitus here.
99, 99, 99, 99, 99.
All right. Wonderful. I'm just going to do some palpation here, or percussion. And while I'm percussing, I'm just also just visualizing your anterior, posterior lungs, your lateral lungs, assessing all of them. Everything looks uniform. Your anterior, posterior diameter is 1 to 2, which is normal for you, so that's great. So after my lung assessments, I'm just going to be listening to your heart sounds. So what I'm going to be doing is you can just relax, and I'm going to take a listen to your apical pulse here. Your pulmonic, and that's about the second intercostal space. Your Erb's point. Tricuspid, which is the 5th intercostal space, and your mitral, which is the 5th intercostal space, mid-axillary line. I'm going to feel your aortic area here. Feel your aortic pulse. All right, that's great. During all of these assessments, I would obviously be going underneath your gown and listening to your lungs. I should have done that, but I would normally be doing that. I'm looking at your hands. I'm noticing any edema, tinting, swelling, redness. Why don't you give me a good grip here? All right. Let's do some supination and pronation. All right. Extension, abduction, adduction. All right. Any pain or discomfort there? Wonderful. I'm going to feel your brachial pulses. Feel your radial pulses. I'm going to assess your reflexes here. Assess your reflex down here. Good. 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 So after that, we've assessed your chest, we've assessed your lungs. We're now going to be moving to your abdomen. So what I'm going to have you do is I'm just going to have you lay back. We'll lay the bed flat here. I'm going to visually inspect the abdomen, noting any visible pulsations, any trauma, injuries. The skin is pink, warm, and dry. She's got good capillary refill. I'm sorry, my hands are cold. Next, I'm just going to be assessing some of the arteries here. So I'm going to assess your aortic artery, your renal arteries, I'm going to auscultate your iliac arteries, and then your femoral. All right, great. The next thing I'm going to be doing is I'm just going to be auscultating your bowel sounds. Okay, so I'm going to be putting my stethoscope on, listening for bowel sounds. No longer than 2 minutes. If it's longer than 2 minutes, they'd be diminished, and that'd be a whole new story. Probably want to go into the ER. Alrighty, that is wonderful. So now I'm just going to do some percussion, and I'm going to be percussing for your liver and your spleen, your kidneys. I'm going to be assessing the liver borders here, and normally we like them to be about 2 centimeters, no more than 2 to 3 centimeters past the subcostal margin there. And I'm just assessing for areas of dullness. I'm going to percuss your spleen. Good. Next, what I'm going to be doing is just some light palpation of your belly. I'm going to be assessing your abdominal wall muscles. Are you having any pain or discomfort? No? All right. Then we're going to move on to some deep palpation. So what I'm going to be doing is I'm going to be palpating for your liver, your spleen. Most of the time, these are very difficult things to palpate for, but what I'm going to have you do is just exhale. All right. I'm just going to be palpating for your liver. I'm going to do the same for your spleen here. Your kidneys. Okay. All right, you can breathe. All right. Next, I'm just going to be examining your lower extremities here. I'm just going to visualize them, looking for any swelling, edema, injury, warmth, redness. Are you having any pain or discomfort? Why don't you push against me? All right, pull back against me. Perfect. I'm going to assess your pedal pulses, your posterior tibial pulses, I'm going to look at your feet here, noting any swelling or discomfort there. No. Good cap refill. You wiggle your toes. All right, perfect. So what I'm going to have you do is I'm going to have you sit up. And if you could bring your feet over. I'm going to assess some more reflexes here. I'm going to check your knees out. Good. All right. I'm going to check your Achilles reflex here. Good. Good. All right. And then I'm going to just come back and assess your spine here. Any cervical tenderness?
No.
Thoracic tenderness?
Mm-mm.
Lumbar tenderness? No, I'm not noticing any curvature of the spine, any kyphosis, any lordosis. So that's great. Last couple things we're going to do is, are you having any difficulty with ambulation? No? Okay, I just want you to stand up. Raise your feet up. All right, great. Bend, flex, try to touch your toes. All right, and walk towards me. All righty, perfect. Well, thank you, Stephanie, for being such a great participant, and that concludes my physical examination.